LASIK patients are some of the ones we tend to see the most for refractive lens exchange because they've been used to 20, 30 years of complete freedom from glasses and contact lenses. And now all of a sudden, even though their distance is sharp, even though their computer is sharp, they're constantly having to reach for reading glasses. And that's just not something they've been used to before. They've been spoiled in a sense, right? They've experienced what life can be like having your eyes corrected. And so, yes, those are patients sometimes who do really good with refractive lens exchange. Again, there's a little nuance here when it comes to selecting the right lens. We typically like the light adjustable lens that Dr. Shamie did such a good job describing because we have the ability to fine tune the outcome afterwards. So, someone who's had LASIK, and again, I fall in this same boat. If I needed refractive lens exchange today, if let's say I didn't have LASIK, they would be a 96, 97% chance we would nail the outcome we want after surgery. But in someone like myself who's had LASIK, that chance of really accurately hitting the outcome immediately after surgery drops to the high 60s, early 70s. So there's a 30% chance or so that the eye is going to heal off target from what's intended. And that doesn't mean something went wrong during surgery. It's just the nature of eyes that have had LASIK or PRK in the past. The beauty of the light adjustable lens is it doesn't matter if the eye heals off target because afterwards, using the 90-second light treatments, we can really fine tune things and change the prescription of the lens implant inside our eyes before locking it into the patient's satisfaction. It's futuristic technology because it truly puts the patient in the driver's seat. The patient is in control of their vision. They get to go experience life after surgery for a month or so, and then they come back and give us feedback. I wish my distance vision was sharper. I wish my reading vision was sharper. And then we can simulate that for them and then fine tune it with the light adjustable lens. This is off label, but there is a small subset of patients who've had LASIK or PRK in the past. If everything is totally regular and normal with their eyes, sometimes we can use technology like the extended range lens or like a multifocal lens, but those are really nuanced and we have to do a very thorough and careful exam to make that determination.